pile of activity regarding the usual non-steroidal anti-inflammatory drugs. So please interrupt me. Sorry if I have a too excessive French accent. Do not hesitate to ask any questions, and I will be extremely happy to share with you my experience. One word also, so your product, we have a company name in Belgium which is Artiflex Forte, but I don't know. Prozits, that's the same. Bioextract, I have to tell you one word about that. Bioextract is a very famous research and development company in Belgium. You know, we have a very strong tradition in Belgium in pharmaceutical industry with many companies, and especially there are some of them that are directly incorporated and located in research and development center of the university. So they are very highly scientific people, scientific mind, and this is why, as you will see, this product presents a very strong capacity in terms of technical advantage. Body Science is my own company I found 15 years ago right now. This is a company which is specialized in business development for life science. So we work with many life science companies, and we help them to export their product, not only at the level of sales development, but also for regulatory purpose and clinical trials investigation. So based on that, I will be able also to share with you the experience regarding Prozit in clinical trials and preclinical development. So, any questions already right now? Feel free, don't hesitate. No? Okay.
Bioextract, you're saying is affiliated, maybe they don't know, affiliated with which university?
University of Agricultural Science of Jean Blou. It's very near of Brussels.
Not the Liège?
No, Liège is a clinical research that has been realized.
Okay.
So Jean Blou, you have to know, is one of the ancient agricultural universities in Europe that were found, if I remember well, in 1815. And this is a place where the majority of European bioengineers go to be educated. And Jean Blou University have connection with approximately 175 countries worldwide. And this is very famous in, let's say, plant and extract understanding.
Can you spell out the word Jean Blou University?
Jean Blou, it's a G-E-M-B-L-O-U-X. Gamblou.
Alright, got it? You can search in your website.
If you want a website connection, this is fsugx.com. But I will check after and give you the correct UI for your information. So now we are talking with Prozit about an excellent natural anti-inflammatory that is positioned for achieving an analgesic effect, but also a cartilage protection, and also, of course, a long-term safety. I have to remember that osteoarthritis is a very common disease that affects a lot of people worldwide, and that grows every year by 12%. The majority of the people suffering of osteoarthritis are mainly elderly people, but you have to know that this is a process that starts already very earlier with the people. And this is typically osteoarthritis, an inflammation disease. It's important what I'm highlighting. Inflammation disease characterized by cartilage destruction. Cartilage, what is it? Is there anybody that can summarize what is cartilage?
It's the muscle within the joint.
Yeah, excellent.
Like loop.
Yes, you know, it's a little bit like with your car. You know, for absorbing the shock on the road, you know, you use, I forgot the name of this. Yeah, and so your cartilage has a purpose to ensure, you know, the mobility of your joint, okay? And it means that with osteoarthritis, these tissues are definitively affected. And this is why the people suffering of osteoarthritis, they have many kind of symptoms that can be pain, of course, but also stiffness or difficulty, you know, to move correctly, because the joints are not able to move properly anymore. Okay? So it means also that the people that have, for example, intensive sport activities, because of the potential of injury, are also extremely sensitive and will probably develop also later osteoarthritis. This is really the problem, because when you are young, you don't feel especially that you have osteoarthritis. The only one way to do is to make in the hospital, in the clinic, a radiography examination. But if you don't have any particular permanent pain, you will not do it. So everybody forget it, you know. But I can assure you that this process starts already very early, you know, through the people. And so we may experiment different kind of symptoms with osteoarthritis inflammation. Let's say that the very first one and recognized is pain. But this is not the only one. And I want to highlight also the question of pain. You must know that the origin of joint pain may be multiple and may involve different kind of potential cause. You don't have especially pain only for or because of osteoarthritis. In some cases, it can be another origin. And this is a confusion that the people do generally, telling that, okay, I have pain, so it is osteoarthritis. Not necessary. And for example, if you take another disease which is called rheumatic polyarthritis, you know, a lot of people confuse generally this rheumatic polyarthritis with osteoarthritis. That's quite different, you know. And it's so different that it involves other kind of treatment. In this case, for those very intensive pain, it would be better and recommend to take a central drugs, you know, acting at the level of the brain, a painkiller, a true painkiller acting at the level of the brain, and not especially something like non-steroidal anti-inflammatory drugs. So the quality of the diagnostic is really crucial to be sure to give the right treatment. And of course, it's dangerous to recommend Prosate, maybe for someone that will have to take another type of therapeutic drugs class. Once again, I want to share with you my experience. And in 1993, the first product in osteoarthritis I introduced was a product called Brexin. And Brexin was a combination of piroxicam of Pfizer plus beta-cyclodextrin molecule, which is, let's say, an industrial process allowing to get more absorption, you know, with the active principle. The first doctor I visit, you know, during, let's say, the first 3 months, some of them were quite skeptical regarding this Brexin. And I would like to tell you it was a true drug, a true synthetic drug with a registration complete. So you can imagine me, I visit, you know, as medical rep, hello doctor, please prescribe my product. And a few weeks later, when I came back to the doctor, fire, John, overkill, it's not a good product. I have still people suffering of pain. Can you imagine? Difficult to manage this kind of situation. And you know, the reason was that they don't give it to the right patient. They gave to patient that had some other origin of pain, you know, where the typical mechanism of action of non-steroidal anti-inflammatory drug was not appropriated. Can you imagine a company like Pfizer? They certainly never introduce bad product or not efficient product. They have tons of clinical trials to support their product. Even as medical reps of Pfizer in that time, we experiment doctor which had no effect with the drugs. So this is why the quality of the diagnostic is really crucial. And the problem is that, you know, when you have, for example, excessive cholesterol, you make a blood analysis and you know your rate. So you know directly if the drugs or the product you took is efficient or not. It's very simple. But for osteoarthritis, we don't have a blood analysis. We have simply patient report. or maybe radiography evaluation in hospital, but it's so expensive that nobody do it on a very regular way. So it can explain why in some case maybe you could have, let's say, not all the time good report about the use of a non-steroidal anti-inflammatory drug. The second point also that is quite important, there are different kinds of patients suffering of osteoarthritis at different stage. And the problem is that with this disease, some of these patients, sometimes, they feel better. Osteoarthritis is really characterized by inflammation storm during short period of time, let's say 5 to 7 days. After that, the pain is naturally declining, and after a certain time, come back again. Sometimes we have information telling that maybe weather change. For the elderly, for example, if they change climate, they go to a more colder region, or if there is more rain, they feel, suddenly they shoulder pain. So it makes also more difficult, to evaluate correctly a product. And I can tell you that all non-steroidal anti-inflammatory drugs experiment also this kind of problem. So let's say that you must be very careful when you introduce an anti-inflammatory new product with the fact that it will be given in priority to a new patient case. That experiment, of course, may be some inflammation pain, but the main goal and the main objective will be to reduce and to inhibit the cartilage destruction process, and I will come back a little bit later. So keep in mind that pain is, of course, one important symptom, but also head, swelling, stiffness. You may experiment this kind of pain at different localization. It can be the knee, it can be the shoulder, hand, hip, it depends. And there are, of course, many causes for these kind of symptoms relevance. Cartilage destruction is definitively the key characteristic of osteoarthritis. Excuse me for this very barbarian draft. I will try to summarize a little. Everybody knows the non-steroidal anti-inflammatory drugs. Clear?
Yeah.
Stop me, interrupt me. No, there are no bad questions. Okay? So, the typical mechanism of action of piroxicam, for example, drugs, Celebrex, etc., is the pathway of the acid arachidonic cascade, because it involves the activity of different enzymes, such as lipoxygenase and cyclooxygenase, with the expression of two isoenzymes, COX-1 and COX-2. This pathway, is typically the mechanism of action of drugs, of non-steroidal anti-inflammatory drugs. So, when you have pain relief, it's because you inhibit cyclooxygenase. And ideally, in a selective way, the isoenzyme COX-2, because COX-1 is an enzyme involved in your stomy protection. Do you know non-steroidal anti-inflammatory drugs are recognized for giving potential adverse effect when you take it a long time? Okay? The problem, one of the problems of this adverse effect is due that before we didn't have any selective COX-2 inhibitor. All the non-steroidal anti-inflammatory drugs inhibit completely cyclooxygenase, so as well COX-1 and COX-2. The consequence was a pain relief, of course, but also adverse effect, because if you take permanently in chronic use, you experiment one moment blooding at the level of the stomy, involving in some case, some severe case of gastric duodenal destruction. There are also other identified mechanisms of action involved in osteoarthritis. One is the pro-inflammatory cytokine called interleukin 1, 6, and 8. Simply, I don't go into many details, keep in mind that this mechanism of action is directly involved in the cartilage destruction. If you want, at the level of your joint, you have what we call a synovial membrane. This synovial membrane